Hi, I'm Justin Riley. Today on Wisconsin Doctors, we'll be on location at the birthing unit here at Upland Hills Health in Dodgeville. My guests will include Dr. Maria Sangron, who's OBGYN doctor here at Upland Hills Health. And Dr. Sandgren received her training from the Karolinska Institute in Stockholm, Sweden, and her specialty training from UW-Madison. She started here in 2015. Dori Christenson is a registered nurse here at Upland Hills Health, has been with Upland Hills since 1998, and received her training from Alverno College in Milwaukee. And Barb Yanna, a registered nurse here at Upland Hills Health since 2001, received her training from Viterbo College in La Crosse. It's all coming up right here on Wisconsin Doctors on CW57. Stay right here. Welcome to Wisconsin Doctors. We're on location here at Upland Hills Health in Dodgeville, and we're in one of the beautiful birthing center suites here. This is such a nice place, and we're so glad that we got a chance to film here today. My first guest is Dr. Maria Sangron, who is an OBGYN here at Upland Hills. Welcome back.
Thank you.
Good to have you here. So Maria is going to be talking to us a little bit about the brand new clinic that's opening up in Mount Horeb. Can you tell us a little bit about that, like where it is, when it's opening up?
I think we're looking at the first week in May for opening the clinic officially, and it's located really very central. If you're going in and out of Mount Horeb towards Madison, it's next to Miller's grocery store, by the Farmers Insurance Building. If you come from downtown Mount Horeb or Main Street, it's the second roundabout as you pull out. It's going to be a clinic for the whole family. It's a beautiful new facility. We will not have birth suites there, but we'll be offered, close to everything else. So
awesome.
For kids, adults, teens,
Sure.
men, women.
Awesome.
Okay, and Maria, are you going to be the only provider there, or will there be other providers at that clinic?
I'll be starting out with Emily Radke, who's one of our nurse practitioners, and then who the whole family can see. And then in August, we'll get a full-time family practice doctor, Dr. Joseph Berg, who's going to be part of the practice, and then we'll kind of build it from there. But like I said, it's going to be a place where everybody can go and very conveniently located.
Nice.
Very cool.
Right. It sounds like a well-rounded clinic, but I mean, are there going to be other services like audiology that might come in, or other things like that?
I think that's a little bit up to figuring out what the needs of the community are going to be, because we are a new entity to this localization, and so we don't really know. But I think there's a great openness from Upland Hills Health to provide services if we find that's being asked for and there's a need for that, to expand, for sure.
Absolutely. And so, some people I think have assumed that this might just be, because you're going to be the first provider there, that this is an OBGYN clinic only, and it's not.
No, it's not.
So there'll be family medicine and other services provided there.
Yes, definitely.
Right. Very cool.
So you can get your sports physical for your kids, you can get your runny noses, you can get your diabetes checks, you can, whatever it might be that you need, yearly exams or regular maintenance health care, or women's health, which I will be the provider for.
Awesome.
Which will include pregnant women, women wanting to be pregnant, women absolutely not wanting to be pregnant, or any other female problem from,
Right.
teens to 90s.
Absolutely.
You mentioned that Emily Radke was going to be one of the providers there as well. Is it going to be just the two of you, or is there going to be more? Or is that just something to come?
We're just the starter out people.
The starters.
The starters.
Starting
We're the
quarterback.
starters. We're the starting quarterbacks. Yes, exactly. Running back quarterbacks.
Sure.
So, like I said, Dr. Berg will be joining in August, and he'll be there full time. And Emily Radke will still rotate through at that point, and I'll continue to be there every week. So
I'm just curious, how long has this been? I mean, this has kind of been a long time coming now, this Mount Horeb clinic. Can you talk us a little bit about that, like where the idea started from, things like that?
Well, it's been at least a year in the actual practical process.
Right.
But I think there's been expressed from the community a need for more services, and there is no women's health provider permanently in Mount Horeb at this point.
Right.
So we thought that was something that we could provide, and that would be a good complement to what's already in there and a good fit for the community.
So Maria, you'll be bringing the women's aspect, but with Emily Radke and Dr. Berg, they will both be able to see the whole family. So actually,
Right.
the clinic will cover
Everything.
the whole family.
Whole basic family health care. And even though Dr. Berg will not be doing obstetrics as far as deliveries, he's certainly there to help me out if I need to go to a delivery, that he can still, he's still trained in obstetrics and can see pregnant patients. So.
Right, absolutely. Well, Dr. Maria Sangron, thank you so much for the information. And when we come back, we'll actually be talking with Dr. Sandgren again about if you were to have your child here at Upland Hills Health in Dodgeville, one of the birthing suites, what to expect there. So that's coming up right here in Wisconsin Doctors. Don't go away. Welcome back to Wisconsin Doctors. We're on location in the birthing unit here at Upland Hills Health in Dodgeville, and we're going to be talking again with Dr. Maria Sangron. And my next question, I guess, is if folks are going to come here to have their baby, what can they expect? I mean, who will be involved in that process of caring?
Well, of course, the wonderful nursing staff that's here, very crucial part of any labor activity. They might need an anesthesiologist, and they're also very much more likely to have their doctor deliver their baby if they come here versus one of our bigger hospitals in Madison.
You just kind of get whoever's on call there. So
usually, not always, but usually, it's just a different system, and it's not wrong or right. It's just a different aspect, and it can be done here to have your own doctor, which is not feasible in many other institutions. If you need certain pain relief, like I said, the anesthesiologist will be a big part of your team as well.
Yeah, absolutely.
Talk about pain relief, anesthesia. Is it just epidurals that is offered here, or is there anything else that they can use for pain control?
I mean, you can bring your own good music to relax to. You can have a partner giving you massage. There's one room here that has a whirlpool tub where you can labor if that's appropriate. We have birthing balls that can be helpful for back labor. We have narcotics if you move up the chain and then epidurals if that's something that you desire or could benefit from. So there's a whole spectrum that's available, just like anywhere else.
Yeah.
And Maria, can you tell us how long is a typical labor? What can a patient anticipate how long they're going to be here?
It depends on how you count, because most lay people think the first contraction, that's when labor starts. But the definition of labor is actually contractions that opens up your cervix. And you can have contractions for a long time before you actually get to that point that things start happening. But once you're there, depending on if it's your first baby or your consecutive second, third, fourth baby, it's going to be faster or shorter. It can be anything from 8 to 10 hours to 20 hours. And it's all normal. It's just a matter of how your body works.
Now your clinic is in Mount Horeb.
Mm-hmm.
How long would it take someone from Mount Horeb to get to the hospital?
About 20 minutes from Mount Horeb, because I drive there daily myself, so I'm pretty good with that. And it's very good, 4-lane highway, no intersections, well, there are some intersections, but not for you to have to stop at, no stoplights. So it's a very easy ride and usually going against traffic. So it's every bit as close as going the other direction without all the hassle.
Nice, very nice.
All right. Birthing plans, are those something that everybody should be looking in, or who can help them with birthing plans?
Well, there's a lot of talk about birth plans, particularly in classes that couples take, and I think there's a curse and a blessing with birth plans. I think they can be very helpful to look at, to get you ideas of questions, things you need to ask your doctor about regarding the whole birthing process. But I think it's a huge mistake to think that you can plan the birth. Like I always tell my patients, it's like, you're coming in pregnant in labor, you go home with a baby. What happens in between is going to be very different. It's like Las Vegas. What happens in Vegas stays in Vegas. But you throw your contraction strength, the size and shape of your pelvis, the size of the baby, how the baby's coming down in the pelvis, and you throw all that in a pot and stir it up, and that's your labor. It's not going to be compared to anybody else's. So locking yourself into doing it a certain way, I think, is a huge mistake. Be open-minded. Know what you would like if that works, but be
so
open.
I hear you saying kind of use it more as a guide and not like a plan.
Right.
So you don't necessarily feel like maybe you failed if you don't
Stick to everything.
Yes.
Because particularly, I think it's more relevant maybe for repeat moms who know what they're heading for and know how their body does and tolerates things. But if it's your first baby, I think it can help inform you, but don't be so rigid that you think that's the only way you have to do it.
Yeah,
I
absolutely.
understand that. So let's say you need to be induced. Can you tell us a little bit about induction? Oftentimes Pitocin is used, and can you tell us a little bit about Pitocin?
And we just have a couple of seconds left.
Yeah, I know. So Pitocin is something to help strengthen your labor. There's a myth that Pitocin labor hurts more than regular labor. Wrong. It's labor that hurts, and the only reason we use Pitocin is because you weren't actually in good labor.
Right.
So
Yeah.
only used as needed.
Used as needed. Well, Dr. Maria Sangron, thank you so much for joining us, and we appreciate the information. Don't go away. There's more Wisconsin Doctors coming up right after this. Stay tuned. Welcome back to Wisconsin Doctors. We're here on location at the birthing unit here at Upland Hills Health in Dodgeville, Wisconsin. And my next guest is Dori Christenson, registered nurse and the maternal child director here at Upland Hills. Welcome.
Hello.
So tell us, why come here to have your baby? Why come to Upland Hills Health here at Dodgeville?
Well, I would like to start out by saying we have an awesome staff here. Nurses, well educated. Our nurses have certifications in which is advanced life-saving and obstetrics. They're trained in stable, which is like infant stabilization for babies who might be having a difficult start. NRP, which is neonatal resuscitation, and we have some of our staff are instructors as well, so that bodes for the level of knowledge and expertise that we have here. Also basic life-saving and ACLS, which is advanced cardiac life-saving, which allows us to, our C-section moms, get to recover in the rooms, giving them a longer period of time to be with their babies.
Absolutely.
We also have a central monitoring system. We have infant security, things that help patients feel safe and comfortable here.
Very cool.
There's a lot of things that we have. Is there anything that we do to help them prepare for going home with their baby and how to adjust to that new lifestyle?
Yeah.
Life after birth.
Yeah, yes. We do quite a few things. Lots of hands-on teaching here while patients are here. Moms learning how to take care of babies. Lots of breastfeeding support. We have lactation consultants here that will also see patients individually while they're here and also after they go home. We have a newborn channel that enhances the education that we provide. We do follow-up phone calls once moms and babies are home, checking in to see if there's any issues, if they have any questions. So we kind of like to give them as many tools as they can to go home feeling very comfortable taking care of their newborns.
Yeah, that's quite a transition.
Yep.
Yeah.
So, I mean, we deliver them here, they go home, we help them out, we prepare them for all that. Is there anything else? I mean, what makes this such a nice, homey place to come and deliver?
Well, part of it is the rapport that our patients have with our staff. You very often will labor, deliver, and have your postpartum and newborn care with the same staff. So these nurses know you very well. This is a very personal and intimate event in your life, and to have these close ties with these nurses who know what your labor was like so they can really help you once you have delivered and with your baby and stuff. So that I think is really, really awesome.
So you've got the same staff throughout the whole thing. Do I bounce from room to room, one for like labor, one for delivery, one for recovery, one for postpartum, or how does that work?
That's a good question, Barb. You are in the same room, which is nice not to have to move around. Your room, we bring in equipment to take care of the delivery process. We move the equipment out, so your room is very homey. We have nice leather couches that pull out that the dads can sleep in, although a lot of dads even like to just hang out on the couches because it's pretty comfortable.
Yes, they are.
Yeah, so very nice to just be in one room and family oriented.
My wife actually preferred to sleep on the couch after delivery, and then I slept on the bed. So that's how that went.
We've seen that a few times.
Sure.
Where the nurse comes in. Oh.
Right. Yeah. Who delivered the baby here? Anyway, so
Yeah.
So it sounds to me like you're not a number when you come here. People know who you are because you have it's the amount of people who are coming in to serve you is limited
Right.
to the same people.
We do pre-delivery conferences, which I won't go into that a lot right now, but our staff get to know what patients desire for their labor process and whether they want their babies in the room the whole time, and we pretty much cater to what the patients want. So we really have a good listening staff, and they really do cater to the patients and their needs.
Awesome. Dori Christenson, thank you so much for the information today. We appreciate that.
You bet. Thank you.
Don't go away. There's a little bit more Wisconsin Doctors coming up right after this. Stay tuned. Welcome back to Wisconsin Doctors. Again, we're here on location at the birthing unit at Upland Hills Health in Dodgeville, Wisconsin. And my next guest, is Barb Yanna, who is a registered nurse here at the birthing unit. Welcome.
Thank you, Justin.
Good to have you here. This is a question that I think is applicable to both moms and dads. We've all heard of Lamaze classes, but Lamaze is kind of a general term for just classes, general birthing classes really nowadays. Can you tell us a little bit about some of the general birthing classes that are offered here at Upland Hills Health?
Well, here at, we have a childbirth class that's offered every month. It goes over, it could be a Saturday session for 6 hours or 2 Wednesday sessions for 3 hours each. We talk about relaxation. We show them videos about what they call purple crying, which is when the babies cry for no reason and you just keep trying everything and they just keep crying. We teach them infant CPR. It's not a certification, it's just an instruction. The other things, we just talk about, we show them a C-section video and a birth video, so that a lot of them will, it's okay. Yeah, it's usually the dads, it's the dads going, oh my, that's it. It's like, you get through it.
Sure. But it prepares you. I don't want to use, it's almost like a desensitization process so that you're not shocked.
Shows them some breathing techniques. Right. There's no one right way to breathe.
Right.
I don't care if you hee-hee-hoo or
yeah.
As long as you're breathing, you're not holding your breath, I'm a happy camper.
Right. Sun salutations.
Yes. And we also talk about visualization to help keep calm. I've even taken one lady who, during deer hunting season, took her on a deer hunt because she was an avid hunter. She was here in labor. And I'm like, where else would you want to be? Out in the woods. So I talked her through a deer hunt, and she did amazing.
Yeah.
So only in Wisconsin.
And that speaks to how our nurses are very personable with the patients. And
Right.
Yep. Other classes that we have here are also Breastfeeding Class, which is offered monthly. Like Dori said, we have a lactation consultant here on staff, Michelle Esser. She's very great. She does one class every month for an hour. We also have a sibling class. Kids 2 to 12 can come in. That's an appointment base. They just give us a call, 930-7139, and we can make the arrangements for the timing.
That's right. And with the breastfeeding support, There's also individual, is that correct, Barb? Can people call anytime?
Right, they can come in individually. I mean, the breastfeeding class is usually meant for prior to delivery, so you have an idea of what's going to be happening. So once you deliver, that hopefully that first feeding goes much smoother.
Right.
Okay, so Barb, I talked about some of the reasons why this is a great place to have a baby. Why don't you tell me some more reasons? You know,
As you can see, we're in a nice, large, spacious room. You did talk about the central monitoring, so that means they can be up and about. Even if they don't want to be up in the hallway walking around, they can be here in the room. It's large enough that you can walk circles without getting dizzy. You can have the birthing balls in here. Family can be in here. As long as we have enough space to do our job, we're happy. We have, you talked about the central monitoring, so say like this morning there was 2 in labor. You could see what was going on in the other room at the same time that you're in with that labor patient, and to make sure that everybody's having a safe labor and delivery.
Right.
so, right.
Yeah.
We do.
Oh, go ahead.
I was going to say, we also have the pre-delivery conferences that you talked about before. So they come in ahead of time and we go over their history with them to make sure that everything's well, so we're prepared for them.
Yes, absolutely. So again, it sounds like a kind of a situation where you're not just a number when you come here. People come in and they make an effort to get to know you, know what your interests are, and having the pre-conference or the pre-labor conferences sounds like something that's pretty unique.
It is. It's very nice. You don't have to huff and puff through the questions when you come in.
Right.
It's not something you want to do then.
Right.
So it's
right.
a very nice
all
thing.
that's taken care of ahead of time.
Yeah.
And does that allow patients to address concerns perhaps
Yes, it
prior
does.
to coming in?
Yes, because that way, I mean, if there's a concern that the doctor needs to know about, we can even say, hey, this is something you might want to talk with your doctor about prior to coming in, so that we're all ready for that.
Okay. Can you tell me a little bit about, is the baby like allowed to stay in the room or?
We encourage rooming in. There's several procedures that we do that we might take baby out to the nursery, hearing screening, jaundice check. We do a 24-hour cardiac monitor just to make sure that there's no issues there. If baby is getting circumcised or parents have decided to have the hepatitis B immunization, and we do car seat checks here. We can check to make sure that it fits the baby properly and it's in good condition.
Right. Right.
Okay, let's say a mom wanted to have the baby stay in the room the whole time. Are they able to have those tests and stuff that you talked about done in the room?
Yes. We don't do the circumcisions in the room. That's the only.
That's the only thing.
Yeah.
Yeah.
But everything else, the hearing
Yes.
screen and all that.
Yeah.
Okay.
It's all done right here at Upland Hills Health. So, Barb Yanna, thank you so much for the information. It was great talking with you today. My guests here at the birthing unit at Upland Hills Health have been Barb Yanna, Dori Christenson, and Dr. Maria Sangron, who will also be working at the new Mount Horeb clinic opening up very soon. Thanks for watching Wisconsin Doctors. We're inviting you here at CW57 to live longer, live better. We'll see you next time.